Hey, my name is Caleb. I'm a PCU slash like med surg RN, so no ER, no ICU, and I'm in year 3 of being a nurse. Nursing schools and how they prepare you to be a safe nurse, but they don't prepare you on how to be like a regular nurse, I guess we'll say, or at least mine didn't. Like it's okay to not be okay. It's okay to not feel prepared to take care of, 4 or 5 patients on your own. It's okay to not feel like you're ready to, manage all the medications and timing appropriately. It's okay to feel like you're not good at talking to doctors. It's okay to feel like you're overwhelmed, overworked. Those are all okay feelings to have because a lot of the times they can be true. And my first suggestion would be if you really feel unsafe as a nurse, then you should always ask your manager for more time. You need more time to learn, to develop. You don't feel safe on their floor, and that manager will 100% give you more time. And if they don't, maybe you need to look for a different spot. But it's only going to affect you, the patients, and that manager poorly if they don't give you more time. I will say that safety as a nurse is the number one thing. Whatever you do, just make sure you're being safe. If you're safe, you can do anything. You're gonna develop. You're gonna learn. You're gonna grow. The only way to be a better nurse is to show up day in, day out, and be a nurse. That comes with time management. That comes with critical thinking, with figuring out when a patient is deteriorating. Who do I talk to? The doctor all the time. Okay, so you can talk to the doctor whenever. The S bar is great for talking to doctors, but really these doctors nowadays they're handling so much. They normally are very up to date on the patient, but you can give them a brief like little note like, listen, this is why this patient's here. This is what's been going on today. Here's some medications they received. Current vital signs all the time, especially if you are asking for another medication or asking for help. um, Demonstrating the severity of a situation by vital signs and symptoms are huge. That's one thing I did not know in nursing school coming out is how big symptoms are, which goes back to your patient. What does your patient look like? Not always the numbers. What does your patient look like? How are they presenting? What's going on there? Okay, tell them about symptoms. But you have to use everything at your disposal as a nurse. So don't be afraid to, okay? You're never gonna come off mean. You're never gonna come off bossy, okay? You have physical therapy, case management, you have speech therapy, dietitians, you have people there to help you. So use them, ask for help, delegate to other people, delegate to that nursing assistant, okay? There's ways to be nice and still get people to do what you need help doing. At the end of the day, being a safe nurse is the best thing. So I know that you didn't learn a lot about charting in school. I know that some people might feel like excellent charters, but when it comes to that direct patient care, it's tough. That's great. Let's get better at that. Focus on those things when you're at work. The main thing that's helped me thus far in my career, and I'm not some insanely amazing RN, but I'm a safe RN, and I minimize my stress by increasing my knowledge on things. If I don't know something at the end of the day, if I am confused, the first thing I could recommend is go to your policy. Okay, what does your hospital's policy say? What is your job's policy? Okay, what are the Lippincott policies? That's a big one. People can look at. Go and look at these things. Become familiar with them. They are tools. Okay, and if you can't really do it during your shift, come in a little earlier, do it at home. But it will help minimize stress so much. I think the more knowledge you have, the more prepared you'll be for situations and the more, tools you have at your disposal. So, increasing your knowledge just with the most basic things. Shoot, if you have to Google search things to make them stick in your brain, if you're having trouble with them, do it. Whatever you can do. Um, Put yourself in situations to grow and don't always look at negative situations as I'm a crappy nurse or I'm a crappy person. Okay, there's a way to grow from every decision, from every situation. If you don't feel comfortable with something, specifically like a crash cart, go get comfortable with it, seek out help. Okay, because you'll be surprised how many other nurses that are tenured and that have been there for a while might have the same questions. Okay, I mean, I cannot tell you how uncomfortable a crash cart made me. Okay. And yeah, there's still questions that I might have about it, but I made it my goal to go put my hands on it every day, turn it on, you know, make sure it works, make sure I know which buttons do what. We have educators at my hospital. Oh my God, they're awesome. Okay, I would go ask them questions on questions on questions. Um, and it just helps so much. It helps ease my stress. Um, there's a lot behind faking it until you make it too. Okay. Nursing school teaches you how to be safe. They don't always teach you everything there is to know about being a nurse. And, going in each day with like laser confidence and just um, not like a high ego, but confidence in what you do, the work that you put in to get where you're at, what you do know, leaning on your strengths, those things can all help you so much. So, as a new nurse, it's gonna be tough. It is. It's okay. Well, it's a long life. Hopefully, but it's a long life. Just keep that confidence, and if you're in an uncomfortable situation, um, sometimes it's not always a bad thing, and make it a comfortable situation after that. Okay. So yeah, that's all I got.